Bennington really reflects what Vermont's all about. I mean, you come here and you've got the beautiful mountains and you've got the rolling hills and the bucolic pastoral settings. You have the rich history here, and you have people who really are quite remarkable in terms of how they welcome you and really make you feel you're part of the history. Southwestern Vermont healthcare is very unique. It's a special place. We're a small organization, but the people here, their focus is on creating a preeminent healthcare system, one which we can all be very proud of.
I do think there's an advantage for patients to be treated in a place where this culture of personalized medicine is so prevalent, where you don't receive a one-size-fits-all treatment. If we're trying to get the best outcomes for our patients, we need to treat our patients as individuals. And because of that culture within our staff and faculty, I think that we're able to provide more effective care, we're able to spend more time with patients, we're able to recognize things that may be coming that we may need to deal with and have on our radar.
They were all about what's important to you, we're going to do it for you. So having that healthcare right here and close to me with that flexibility is something I couldn't have gotten anywhere else. If it wasn't for the doctors at SVMC, I wouldn't have been able to have my treatment so close to home and be here with my family and stay connected with my community, which was part of my healing. And I really value that.
I enjoy being a part of the community because it adds a depth to one's life. And family medicine is really based on getting to know the individual. David Sands is a patient of mine that I've known for years. When he came in to see me a little over a year ago and told me that he'd been having trouble with exercise, I was able to call my colleagues, including Jennifer Thurmer, who's a nurse practitioner in cardiology.
I met David for a routine exercise tolerance test, a stress test.
I had 6 blockages. At least 3 or 4 of them were 100% blocked. I have no idea how I survived as long as I did. If I had waited 2 more days, I would not have survived. If I had decided to go someplace else because I wanted second or third opinions or whatever, I would not have made the trip.
So I remember going back in and I shook his hand and I said, I know I've been a major pain in your neck today, and he just looked at me and he was just really appreciative. About a week after, I came back to my desk at the end of the day and there was a Post-it note on my computer and it said, David Sands called, and I quote, I would not be here today if it was not for you.
If it wasn't for Bob and Jen and the whole organization at SVMC, I wouldn't be here today. It's as simple as that.
I'm very proud to be on the Board of Trustees of this hospital because I know how much the people at this hospital care about their patients and the patient families. I think we have an incredibly caring staff of doctors and nurses. We have an exceptional management team. And I know that everyone revolves around making the patient experience better for everyone that comes to this hospital.
The palpable culture here is that this is a tight-knit community. These are our friends and our family, and they have to come first.
So you look at the new healthcare system of the future, one of the things that we're focusing on is going out into the community and being much more present in terms of different levels of services.
So the start of Safe Arms, it wasn't anything that I identified. It was something that truly came from the nursing staff on Women and Children's. And they were noticing that we were having an increasing number of babies that were withdrawing after delivery, and an increasing number of moms who were in recovery programs for opiate addiction. I think what's unique about our community, though, is that we have the passionate nurses at SVMC who can look at that patient population and not be critical or judgmental in their view of them, but really want to find a way to make things better.
If it wasn't for the Safe Arms program, I wouldn't be where I am today. They're not just there to make you feel like you're doing something wrong. They're there to make you feel like you're going to do something right. I can now get up in the morning and give my children breakfast. I can brush their hair. I get to be a mom. I know who I am now.
Our vision statement is to really become a preeminent small healthcare system that's recognized for providing exceptional care that's cost effective, that's accessible. We think the best way for us to accomplish that is to partner with a nationally recognized institution like Dartmouth that has a very similar philosophy and mission that we do.
I think it's really important as you think about relationships, in particular the Southern Vermont Medical Center relationship and the Putnam Group, which we've been working with for a long time, is what I think Simon Sinek says well. People don't buy what you do, they buy why you do it. And I'm so excited about the why of creating a sustainable health system. And this partnership is all about that why and creating that sustainable health system.
Our relationship with Southwestern Vermont Medical Center has a rich past, beginning with the Putnam relationship a long time ago, and we're delighted with where we are right now. That is but the beginning. I am bold and confident to say that I think for the future of Dartmouth and Hitchcock, our single most important medical center partnership is with Southwestern Vermont Medical Center in Bennington.
Our partnership with Dartmouth is really a tremendous opportunity for us to do things that we could not do on our own here. You know, we're a talented organization, but we are limited by our size. We oftentimes don't have the scale to do services that larger places can do. What Dartmouth has is the intellectual capital and the clinical resources to allow us to do things together in a partnership that I think will allow us to provide more care closer to home. And when there's a need for a patient to go to a medical center for tertiary care, we can create a seamless system for allowing patients to go to Dartmouth or other places if necessary to do that. So the Dartmouth model is to work with their partner hospitals to enhance the level of care, to make the care a higher value. And we think it's pretty special, and we think this is going to be it's a very unique relationship that I think will set the standard for healthcare into the future.